Thank you, Greg. So if I can invite Theresa back up to the stage. So I think we have about 10 minutes for questions before we go to lunch. And so while we've been quietly sitting here listening, someone has called the election early. And that person is Judith Weldon, who has said that, and the question to both of you is, if we have President-elect Biden taking office in the White House, what advice would you give him in handling the dire COVID situation he's inherited?
Look, I think what Australia did in that initial sort of period, look, you can't turn the clock back in the United States, but I was just amazed that the United States didn't, look, they got 50 states, much more complex society, 330 million people. But why didn't they get 8 or 10 governors of the major states that were affected together and have regular meetings about a coordinated strategy in terms of the public health response? That really shocked me. But it said something about the divisiveness and the polarisation, I think, and the lack of any bipartisanship in the United States. So if he can bring people together, as he's sort of been saying, he has to do so much better than the incumbent. And I'm hopeful, I'm absolutely hopeful that he'll be able to start to steer things in the right direction.
Theresa, do you want to respond or?
Yeah, I agree. The lack of coordinated, collaborative approach, and they have so many resources that they haven't brought together, but they've ignored their scientists, they've ignored their clinicians. I've got colleagues, in New York who, wonderful hospitals like Mount Sinai, and not being listened to. And that's the real key, listening to the people on the ground. They can come up with the ideas.
And so maybe elaborating on that a little bit and reflecting on your most recent slide, Greg, on some of the regional differences. I mean, one of the questions that Warwick Anderson's asked here is reflecting on Australia's history, which is one of the earlier presentations. We had a good 1919 flu, AIDS in the 80s and 90s. I mean, is there something about the Australian system beyond our investment in public health, culturally, politically, that we can reflect on? And then if you could extend on that in terms of its regional differences.
Yeah, it's a really good point. I actually gave a presentation last week on some public health response across HIV, Hepatitis C and COVID-19, and some of the sort of commonalities I talked about. And one of the things was obviously bipartisanship, and I think that's been really, really crucial. I think engagement with the community has been absolutely essential, and I think we couldn't be where we are today without the support of people coming forward for testing. I found that quite remarkable, the way that the community sort of stepped up. And I think the jurisdictional sort of aspect, in terms of their responsibility for implementation, but some national strategy sort of development and leadership, and that's what we got from HIV with that community engagement. That was pivotal at the start. And I think our system does work. Our public health system does work, and you can see it breaking down in so many other places. And I've just been, again, really sort of grateful that we've got the sort of foundation to respond in the way that we have.
And I think the community has really trusted the advice being given, because it can see that everyone's working together. No one's fighting and saying, that person is a goose. They're basically having good debate. It's right to have debate. Everyone's not going to agree. But then there's this level of collaboration and support, not only amongst health, but with police and non-government organisations, industry partners, business doing all their COVID safe plans. Even in the hotel quarantine program, in New South Wales, we had very few people refuse swabs. I can't remember what it was. It was like 30% in Victoria, yet in New South Wales, it was very minimal. And I think part of that was that they could see everyone working together. So it gives you a confidence that the advice is right.
Yeah, and I think we sort of sit somewhere in the middle. So you've got the sort of individualism of the United States, You've got some other societies that are more authoritarian in terms of the way that they've responded to the epidemic. And Australia, fortunately, is in I think, a reasonably good sort of place in terms of following and trusting evidence. I mean, it's amazing that Scott Atlas, who's heading up the US task force, one of the hashtags he uses is policy, not epidemiology. I mean, God forbid. I mean, that's the head of their task force. I think as Theresa said, we've followed the science, we've followed the evidence. The public health people have been so accessible, I think, in terms of, again, educating the community has been really important.
So perhaps building on that then, with another question I have in front of me, and thinking about Australia's place in the world, at this time, and with the kind of leadership and governance that we've brought. I mean, certainly when I was in the US earlier in the year, just as the pandemic was breaking, I was at Stanford on the West Coast, and the US was looking to us as our fires were burning, thinking about some premonition of the future under climate change, and interested in ways we might think about that response. Now, with the leadership we've had in health, are there opportunities for Australian leaders, given the International Academy, to begin to shape practice globally and to play our role in a global leadership on this topic?
I think there is. I was reflecting at morning tea. This time last year I was in Philadelphia, and I gave a presentation at the University of Penn Medicine, a huge, big private university hospital, and then I went and visited with an infectious diseases colleague, an area of Philadelphia, Kensington, heaps of homeless people, heaps of people injecting. I came away, and of course I knew that there was a two-tiered system in the US, and I came away and I thought, this is just ridiculous. And I sort of wrote a piece with my colleague, and we had published in the New England Journal about our response to hepatitis C in terms of providing equity of access to people who inject drugs, and the sort of lessons that we, hopefully, could use for other sort of settings to be able to implement. And look, there's a huge gulf. But I think that sort of demonstration, that sort of leadership and making the point that the foundations that we've built are so essential in terms of good public health, I think is a lesson we can use going forward.
I agree.
So maybe then time for one final question. So let me just look at my emails here. I suppose thinking a little bit going forward, so as borders open up, any kind of thoughts, suggestions around how practice will play out going forward, recommendations, what the future will look like?
Well, I've extended all my leases for a long time. I think we'll need quarantine programs, and they are complex. The people who are coming to us, because they're often now coming, they're not the travellers who went on holidays. The people who are coming back are people who have been in countries with poor health systems. And so we have people arriving at the borders with severe dementia, with a whole range of other clinical conditions. And so we need to look after them. And I think that's one of the great things of our health system, is that fact that we do focus on the needs of the individual as well as the needs of the whole, the community. We've got to do both. We can't just do one. And I think that's a really important lesson and something for the whole community to be proud of. That's the way of keeping the community on board, is to make sure that they think that we haven't left the individual behind while we look after the needs of the community.
Just a couple of things about borders. I have to declare my conflict of interest in June. I actually booked a holiday in Burleigh Heads in early December, so sweating on what's going to happen. You don't want to come to quarantine. what's going to happen. I have to have a chat to Jeanette Young. But I think as the borders open, I think they will open, that means that we have to have better jurisdictional coordination in terms of surveillance and aspects of contact tracing as well. So some good sort of national coordination around that. Look, I think it's inevitable that we will open up borders, but I think they've actually served us well. And I think in terms of the international borders and the centralisation largely of the hotel quarantine in Sydney is a thing that I'd want to continue. I wouldn't want 5 different sort of entry points into Australia. I think New South Wales is doing it so well, and I think I'd be really supportive of continuing that. The feds need to cough up some money to support that. But to open up Melbourne and Brisbane and as other sort of areas to sort of, I think it's going to be more problematic, and there's more potential breakdown, I find, in the system, rather than a system that's working very, very well.
So I think that brings us to time with this session. Perhaps on behalf of all of us, Theresa and Greg, thank you so much for making time to be with us today during this difficult time to share your insights, and also for your service to our community. So it's been a really wonderful session, and please thank them on behalf of all of us. So.
Thank you.